Hey, parents! Have you ever seen your child hold their breath until they turn blue or pale? It can be incredibly scary, but don't worry today, we're going to talk about breath-holding spells in children. Stick around to learn what they are, what causes them, and how you can handle them calmly and effectively. First, let's understand what breath-holding spells are. These are episodes where a child stops breathing for a short period, usually triggered by frustration, anger, pain, or fear. While they can be alarming, they're generally harmless and don't pose long-term health risks. There are two main types of breath-holding spells. Cyanotic breath-holding spells, the most common type. These occur when a child holds their breath until they turn blue, typically after a crying fit. They often happen in response to strong emotions like anger or frustration. Pallid breath-holding spells, these are less common. They occur when a child experiences a sudden shock or pain. The child may turn pale and lose consciousness briefly due to a decrease in heart rate. What are the symptoms to look out for? Crying or screaming before the spell starts. Holding breath until turning blue, cyanotic, or pale, pallid. Brief loss of consciousness. Sometimes, twitching or brief convulsions. So, what causes these breath-holding spells? They're involuntary reactions that often happen in response to emotional or physical triggers. Remember, they are not deliberate and are more common in children aged 6 months to 6 years. If your child has a breath-holding spell, here's what you should do. Stay calm. Your calmness can help your child recover more quickly. Ensure safety. Make sure your child is in a safe place where they won't fall or injure themselves. Wait it out. Most spells are brief and resolve on their own within a minute. There's no need for CPR unless the spell is unusually long or your child doesn't start breathing again. When should you seek medical help? If the spell lasts longer than a minute. If your child has frequent breath-holding spells. If your child has other symptoms, such as seizures or developmental delays. How can you help prevent and manage these spells? Stay consistent with discipline. Consistent responses to behavior can help minimize frustration and anger in children. Identify triggers. Understanding what triggers your child's breath-holding spells can help you manage and potentially avoid them. Positive reinforcement. Encourage good behavior with positive reinforcement and praise. Medical consultation. Regular checkups with a pediatrician can help monitor your child's development and manage breath-holding spells effectively. In conclusion, while breath-holding spells can be frightening, they are generally not harmful. Understanding and managing these spells can help you respond effectively and reduce their frequency. Always consult with a healthcare provider if you have concerns about your child's health or development. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more parenting tips and advice. See you in the next video. Happy parenting!